just 12 days, on January 30th, 2026, Medicare's temporary telehealth expansions expire completely. This isn't just another policy tweak. It's the end of pandemic-era flexibilities that allowed millions of seniors to receive medical care from their living rooms, kitchens, and bedrooms across America. After January 31st, the majority of Medicare beneficiaries will lose the ability to access most telehealth services from home, and those who can still qualify will face new restrictions and requirements they haven't dealt with since 2020. We've already seen what happens when these waivers expire. From October 1st through November 11th, 2025, during the federal government shutdown, these same telehealth flexibilities lapsed completely. Claims got returned, patients paid out of pocket, and many clinics simply stopped offering virtual care rather than provide services without guaranteed Medicare reimbursement. Congress rescued those services with a last-minute extension, but that reprieve runs out in less than 2 weeks. What makes this moment particularly critical is that we're not talking about convenience. We're talking about access to essential medical care for a population that often struggles with transportation, mobility issues, and geographic isolation. The American Medical Association has been pushing Congress to make these telehealth changes permanent, criticizing what they call the repeated cycle of temporary extensions that undermines reliable access to virtual care, but Congress continues to kick the can down the road with short-term fixes instead of long-term solutions. Let me walk you through exactly what's changing, who will be affected, and what options remain available after this deadline passes. The most significant change coming January 31st is the return of strict geographic restrictions for telehealth services. During the pandemic, Medicare allowed beneficiaries anywhere in the United States to receive telehealth care from their homes. That broad access disappears completely for non-mental health services. Starting February 1st, if you live in an urban area, which includes most cities and their surrounding suburbs, you will no longer be able to receive regular medical telehealth appointments from your home. Medicare will only cover these services if you're physically present at a qualified medical facility or clinic for the virtual appointment. Think of it as going to the doctor's office to have a video call with a different doctor. It defeats much of the purpose that made telehealth so valuable during the pandemic. The only exception to this urban restriction applies if you live in a rural area and you're receiving care at a rural originating site. But here's the catch. Both you and the facility where you're receiving the appointment must meet Medicare's definition of rural. If you live in a small town that Medicare classifies as urban, or if the clinic you use doesn't qualify as a rural originating site, you'll lose home access to telehealth. This geographic limitation doesn't apply to mental health services, which maintain broader access rights. But even mental health telehealth faces new barriers that will significantly impact how seniors can access these critical services. The biggest change for mental health telehealth is the return of in-person visit requirements. Starting January 31st, if you want to use telehealth for psychological counseling, psychiatric care, or other mental health services, you must first have an in-person appointment with that provider within 6 months before your first telehealth session. Additionally, you'll need to continue having at least one in-person visit every 12 months to maintain telehealth eligibility. For many seniors, this requirement creates substantial barriers. Consider someone dealing with depression or anxiety who found it easier to open up during virtual sessions from the comfort of their own home. Under the new rules, they'll need to travel to the provider's office for that initial visit and return annually, even if their condition makes travel difficult or if they live far from appropriate mental health services. The in-person requirement also affects continuity of care. If you've been seeing a therapist or psychiatrist exclusively through telehealth since the pandemic, you'll need to schedule an in-person appointment before January 31st to maintain your telehealth access. If you don't get that in-person visit completed in time, you'll lose telehealth eligibility until you can arrange and complete an office visit. Another major change affects where you can receive telehealth services and who can provide them. During the pandemic, Medicare expanded the types of healthcare facilities that could serve as distant site providers, meaning the location where your doctor or other healthcare provider delivers telehealth services from their end. Federally qualified health centers and rural health clinics will lose their eligibility to serve as distant site providers for non-mental health telehealth services, These organizations serve some of the most vulnerable populations, including low-income seniors and those in underserved communities. If your primary care comes from an FQHC or RHC, your provider may no longer be able to offer you telehealth appointments for routine medical care, checkups, or management of chronic conditions like diabetes or hypertension. This restriction particularly impacts seniors who rely on these community health organizations because they often serve areas with limited transportation options and provide care on a sliding fee scale for those with limited incomes. Losing telehealth access from these providers means many seniors will need to either travel to these facilities for every appointment or find new providers who are eligible to offer telehealth, assuming any are available in their area. The changes also affect audio-only telehealth appointments, which became a lifeline for seniors who struggle with video technology or have limited internet access. Currently, you can have a Medicare telehealth appointment over the phone for many services, as long as you cannot use or don't consent to video technology. After January 30th, the broad availability of audio-only telehealth disappears. While Medicare will continue to cover audio-only communication for certain mental health services, when patients cannot use video technology, the extensive list of medical services that became available via phone during the pandemic will no longer qualify for Medicare reimbursement. This particularly impacts seniors who never became comfortable with video calling or who have internet connections too unreliable for video appointments. Many found that telephone appointments worked well for medication management, follow-up care after procedures, and routine check-ins for chronic conditions. These convenient options largely disappear after January 31st. We saw a preview of these restrictions during the government shutdown from October 1st through November 11th, 2025. During that period, Medicare stopped covering the expanded telehealth services, and the impact on seniors was immediate and significant. Healthcare providers faced an impossible choice: continue offering telehealth services without knowing if Medicare would reimburse them, or discontinue virtual care entirely until Congress acted. Many chose to suspend telehealth services rather than risk providing unreimbursed care. Seniors who had medical appointments during that period either had to reschedule for in-person visits, pay out of pocket for telehealth services, or go without care. The Centers for Medicare and Medicaid Services returned telehealth claims submitted during the shutdown period unless they qualified as mental health services. Beneficiaries who paid out of pocket for telehealth during those 6 weeks had to wait until after November 12th, when Congress passed the continuing resolution, to get their money back through the normal Medicare claims process. This 42-day period demonstrated how quickly telehealth access can disappear and how disruptive these policy changes can be for seniors who have integrated virtual care into their healthcare routines. Providers are now preparing for a similar, but potentially permanent disruption when the current waivers expire on January 30th. Despite all these restrictions, important telehealth options will remain available for Medicare beneficiaries after January 31st. Understanding what services you can still access and under what conditions will be crucial for maintaining your healthcare coverage. Mental health services retain the broadest telehealth access under permanent Medicare policy. Even with the new in-person visit requirements, you can still receive psychological counseling, psychiatric appointments, and other behavioral health services via telehealth from your home, regardless of whether you live in a rural or urban area. The key is ensuring you meet the in-person visit requirements. One visit within 6 months before starting telehealth, and at least one visit annually thereafter. For mental health telehealth, audio-only appointments remain permanently available if you cannot use or don't consent to video technology. This means if you're more comfortable talking on the phone, have vision problems that make video difficult, or lack reliable internet for video calls, you can still access mental health care through telephone appointments. Rural beneficiaries maintain broader telehealth access for all types of medical care, but with important limitations. You must live in a rural area as defined by Medicare, and you must receive the telehealth service while physically present at a rural originating site, typically a doctor's office, clinic, or other qualified medical facility in a rural area. This means rural seniors can't necessarily receive telehealth from home, but they can go to their local clinic or doctor's office and have a telehealth appointment with a specialist or other provider who might be located hundreds of miles away. For rural communities with limited specialist access, this preserved telehealth option remains valuable for accessing expertise that might otherwise require long-distance travel. Certain specific services will continue to have exceptions to the general location requirements, though Medicare hasn't fully detailed the complete list in current guidance. These exceptions typically cover services where telehealth has proven particularly effective and where access barriers justify continued flexibility. Medicare has also maintained permanent coverage for some telehealth services that were established before the pandemic, including certain remote monitoring services and specific types of consultations between healthcare providers. These services operate under different rules than the pandemic-era expansions and aren't affected by the January 30th expiration. The pattern we've seen with telehealth policy over the past year suggests that Congress may act again to prevent these restrictions from taking effect. We've already experienced this cycle twice, once during the government shutdown in October and November, and now approaching the January 30th deadline. However, the American Medical Association and other healthcare organizations are pushing for permanent authorization rather than another temporary extension. Their argument is that the constant uncertainty created by short-term extensions undermines providers' ability to plan and invest in telehealth infrastructure, and it creates anxiety for patients who don't know whether their virtual care options will be available from month to month. The timing of this deadline creates additional uncertainty because it coincides with potential negotiations over government funding. Congress set the January 30th telehealth expiration to match the continuing resolution that funds the government, meaning lawmakers will likely be dealing with both telehealth policy and broader budget issues simultaneously in the coming weeks. Healthcare providers are taking different approaches to prepare for the potential changes. Some are already notifying patients about possible service disruptions and helping them schedule in-person appointments before the deadline. Others are waiting to see if Congress acts again before making significant changes to their telehealth programs. For seniors currently using telehealth services, the uncertainty creates difficult decisions. Should you schedule an in-person visit with your mental health provider before January 30th to maintain telehealth eligibility? Should you assume Congress will extend the waivers again and continue with scheduled virtual appointments? Should you prepare to transition back to in-person care for all non-mental health services? The safest approach is to prepare for the restrictions to take effect while hoping Congress provides another extension. This means scheduling any necessary in-person mental health visits before January 30th and discussing alternatives with your healthcare providers for any non-mental health telehealth services you currently use. It's also worth understanding that even if Congress does extend the waivers again, it will likely be another temporary measure rather than permanent policy. The cycle of uncertainty will continue until lawmakers decide to either make telehealth expansions permanent or allow them to expire definitively. The broader implications of these changes extend beyond individual access to care. Telehealth has become integrated into how many healthcare systems operate, how specialists serve rural communities, and how seniors manage chronic conditions. Rolling back these capabilities affects not just convenience, but the entire structure of healthcare delivery that evolved during the pandemic. For many seniors, telehealth provided their first experience with virtual care, proving that technology could enhance rather than complicate their healthcare. The pending restrictions don't just eliminate a service. They potentially discourage seniors from exploring other technological solutions that might improve their health management and quality of life. Healthcare providers have invested significantly in telehealth infrastructure, staff training, and care protocols designed around virtual delivery. The uncertainty around policy makes it difficult to know whether these investments will continue to provide returns or whether resources should be redirected back to traditional in-person care models. The geographic disparities created by the new restrictions also raise questions about healthcare equity. Urban seniors will lose most telehealth access, while rural beneficiaries maintain some options, but only if they can travel to qualified facilities. This creates a complicated patchwork of access that varies not just by geography, but by the specific classification of your location and the type of healthcare facility available in your area. As we approach January 30th, the most important step for Medicare beneficiaries is to understand their current telehealth usage and plan accordingly. If you receive mental health services via telehealth, Contact your provider immediately to schedule an in-person visit before the deadline if you haven't had one in the past 6 months. Don't wait until the last week of January. Provider schedules may be full as other patients try to meet the same requirement. For any non-mental health telehealth services you currently receive, ask your provider what options will be available after January 31st. If you live in an urban area, you'll likely need to transition to in-person appointments or find out if your provider offers any of the specific services that maintain telehealth exceptions. If you live in a rural area, clarify with your provider whether their facility qualifies as a rural originating site and whether you meet Medicare's rural beneficiary requirements. Don't assume that living in a small town automatically qualifies you for rural telehealth benefits. Medicare's geographic classifications can be complex and counterintuitive. Review your upcoming appointments scheduled for February and beyond. Any telehealth appointments that won't qualify under the new restrictions should be converted to in-person visits now, rather than waiting until after January 30th, when your provider may face a sudden surge in demand for office appointments from patients making the same transition. Consider the practical implications of returning to in-person care. Do you need to arrange transportation? Are there scheduling conflicts with the reduced flexibility of office-only appointments? Will the increased time and travel requirements affect your ability to keep up with routine care for chronic conditions? The story of Medicare Telehealth changes reflects broader challenges in healthcare policy. The tension between innovation and established practice, between access and cost control, between permanent policy and political negotiation. For seniors navigating these changes, the focus has to be on maintaining access to necessary care regardless of how it's delivered. Whether Congress acts again to extend these waivers or allows them to expire, the past year has demonstrated that telehealth policy remains unsettled. Seniors and their healthcare providers are operating in an environment where access to virtual care can disappear overnight due to political decisions that have little to do with medical necessity or patient outcomes. The changes coming January 31st represent more than just a return to pre-pandemic policies. They're a test of whether the healthcare system can adapt to serve an aging population that increasingly values convenience, access, and options in how they receive medical care. For millions of Medicare beneficiaries, the next 2 weeks will determine whether telehealth remains a valuable tool in managing their health or becomes just a memory from the pandemic era. The ultimate resolution of telehealth policy will likely require Congress to move beyond temporary extensions and make permanent decisions about what role virtual care should play in Medicare coverage. Until that happens, seniors will continue to face uncertainty about one of the most significant healthcare innovations of the past decade. The clock is ticking toward January 30th, and the decisions made in the next 12 days will determine how millions of Medicare beneficiaries access healthcare for the foreseeable future. Whether those decisions prioritize access, cost, political compromise, or medical effectiveness remains to be seen. What's certain is that the era of expansive telehealth access under Medicare is ending, and what replaces it will shape healthcare delivery for America's seniors for years to come.